Good afternoon, everyone. We are going to wait a few minutes to let others join us before we get started. Good afternoon, everyone. I'm going to wait one more minute for a couple more people to join us, and then we will get started. All right, we are going to get started. Good afternoon, everyone. My name is Juliet Palin. I am a community engagement specialist from the Department of Public Health. Thank you for joining us this afternoon for a workshop on severe heat, staying healthy and safe during very hot weather. This workshop is our first workshop of 2022 for seasonal schedule in Division of Disease Control Preparedness Program, as we help communities prepare for public health emergencies. Before we get started, I wanted to go over how to use interpretation services and ask questions. You will see our ASL interpreter, Joy Harris, pinned to the top of the screen. And then if you click the globe icon at the bottom of the screen, you'll be able to see different channels that exist. So there are 4 different languages: English, French, Mandarin, and Spanish. You can tune in order to hear the workshop in that language. Just want to give a special thank you to our interpreters for their support today. And to remind everyone that this session will be recorded and uploaded to YouTube, so anyone who couldn't attend today's session can get information later on. I also want to encourage you to ask questions throughout the session. You can type them in the Q&A box. We will answer all questions at the end, or we'll type back to you when appropriate. If you are calling in and your questions are not answered, you can email publichealthpreparedness@phila.gov or leave us a message at 215-429-3016. Again, everyone, my name is Juliette Palin. I'm a community engagement specialist from the Department of Public Health. Along with me presenting is Sydney Walker, a nurse from the department, and members of our team will be assisting with answering questions throughout the workshop. We are part of the preparedness program, and we help communities prepare for public health emergencies like severe heat. And again, today we're going to talk about staying healthy and safe during very hot weather. So I want to first start off and give you a second to think about summertime and some of your favorite things you like to do. For some, it may look like taking a trip to the beach, enjoying summer fruits like watermelon and pineapples, taking a bike ride, or a long walk. What else? Some of you may enjoy going to the pool or having a barbecue outside. For me, it's spending time on Kelly Drive with having a picnic with friends. The summertime is a time to enjoy the warmer weather, be outside more since the sun is out longer. But we have to be careful when we are spending a lot of time outside because extreme heat exposure can make you sick and can even be deadly. As the CDC studies weather hazards, they have found that extreme heat has been the cause of more deaths than any other hazard. On this slide, we have a chart from environmental protection agencies, and it shows heat as the highest number of fatalities in the US and when it compares to weathered hazards. And the numbers of fatalities will go in decreasing order with highest at heat, and then going from tornadoes to flood, wind, cold, lightning, winter storms, and hurricanes. In Philadelphia, between 2006 and 2018, there were about 137 heat-related deaths in the city. So we know that heat is a big concern, and we'll talk a little bit about how heat affects your health a little later. You may have noticed that summer seems to have gotten a lot warmer than when we were younger, when you were younger. It is true that because of climate change and the city is getting hotter, climate change is expected to cause the city to have hotter days than we're used to. On this slide, we have a table that shows the heat projections from Philadelphia's Office of Sustainability Growing Stronger report. And this first row shows average summer temperature in Philadelphia of 84 degrees. And that's based on a historical average from 1950 to the 2000s. And over time, because of climate change, we are projected to see average summer days between 89 and 93 degrees Fahrenheit. The next row is the average number of days above 95 degrees. And so historically, we actually only had 3 days per year above 95 degrees Fahrenheit, which is pretty hot for Philly. It's actually in the 95th percentile of temperatures for Philadelphia. So if we look to the future, our projections are 17 to 52 days above 95 degrees. And that's a large increase from our 3 days that we're experiencing now. And then the last row shows average number of days above 100 degrees. And we're not experiencing any, but with the projections, we're expected to see 2 to 16 days above 100 degrees. So we are anticipating more very hot days, more consecutive hot days due to climate change. So we want to be sure to be prepared on how that will affect our health. Last summer alone, Philadelphia recorded 36 days of 90+ degree weather. And so moving to our next slide, we'll talk a little bit about the urban heat island effect. Heat exposure is a big concern for those of us living in the city, and it is because of the urban heat island effect. This slide shows a slightly abstracted line graph that shows the overall temperature rising as it goes from rural to suburban to commercial to city. This chart shows that while the city may be experiencing temperatures in the 90s, our suburban counterparts may only see temperatures in the 80s. Basically, this shows that cities are hotter than their suburban counterparts because of built environment features like high buildings, industrial activities, lots of roadways that absorb heat. Cities, as we know, can also have limited vegetation and tree coverage, and those things help with natural cooling by increasing shade and decreasing the temperature. As we move to our next slide, we see that heat exposure also varies widely within our own city. So not just from city to the suburbs, but within even blocks of our city. This is a map of Philadelphia and shows an analysis of surface temperatures by census block. The city developed a heat vulnerability index in 2018 to summarize the most important factors associated with health impacts of extreme heat. And this is a data-driven approach to identifying which city neighborhoods are most at risk. So we are able to allocate limited resources like cooling centers and buses and educational initiatives more equitably. The index shows the neighborhoods in Philadelphia that are among the hottest and where residents may be able to manage extreme heat. In the map, you'll see sections of the outer regions of the city. There's a lot of blue on the outside. And as we enter closer to North Philly and Southwest, we see colors change from yellow to orange and move to a darker red. Those dark red areas can be up to 22 degrees hotter than the coolest blocks, which are in blue. And some of these high heat vulnerability neighborhoods in red are Cobbs Creek, Overbrook, Point Breeze, Strawberry Mansion, and Hartranft and Hunting Park. And these neighborhoods have a lot of exposed asphalt and not a lot of trees or green spaces. If you noticed, if you're driving in those neighborhoods, some of the older homes have black or dark roofs, and that type of dark roofs absorb heat, making it hotter in the neighborhood. So if you live in these areas or know someone who does on hot days, you want to make sure you're checking in on them and have someone check on you, especially if you're living alone. The Office of Sustainability Studies have shown that heat islands are significantly associated with heat mortality. And this is due in large that heat is radiated at night in urban heat islands, which increases the nighttime temperature and doesn't really give people a break from the heat. So we recommend staying in air conditioning and not going outside if possible, during the hours of 11 a.m. and 4 p.m. because those are the hottest times of day. And if you have to go outside, to seek shade often. If you'd like to research your neighborhood on the map, I have included the bit.ly, which is bit.ly/PHL heat index, and also have a QR code so you can see where your neighborhood lies on the heat index. In this next slide, we have two neighborhoods in the city. The top picture shows a sunny neighborhood in North Philly with row homes and cars on both sides of the street, and you'll see a lot of sun exposure. The second picture below shows a sunny neighborhood in Center City with row homes covered by lots of trees and shade and cars on one side of the street. We can point out some differences from the pictures. As mentioned in the bottom picture, there are trees, so we see more shade, right? The more opportunity for a natural cooling. And then there's also less cars, so less gas emission. And so we can see how different parts of the city can be cooler just by having trees to cover and less cars. And so it's really important to understand how heat affects your area of the city. Before we move on to the next section, I want to pause for any questions. Are there any questions in the chat?
No questions in the chat at the moment.
Great. So since there are no questions, we will now have Sydney Walker, a nurse from PDPH. She'll discuss understanding the signs of heat-related illness.
Hi, good afternoon, everyone. Again, my name is Sydney Walker, and I'm going to talk to you about understanding the signs and symptoms of heat-related illness and what you can do to help reduce your risk of experiencing a heat-related illness. So before I actually get started on the actual signs and symptoms, I just want you to think about the body's natural way of cooling itself down. You kind of might have to take yourself back to maybe your early childhood education, like middle school or high school science class. And I'll give you a hint if you're thinking about it really hard. Think about how evaporation works. So if you think about it, whenever we sweat, sweat is our body's natural way of cooling itself down. But what sweat does is as it pools on our skin, the outside air is able to work with the liquid that has pooled on your skin and pull the heat away from your body, thus cooling yourself down. And our body's natural way of cooling itself down is extremely effective when it works well. But for either dehydration reasons or for medications you might be on, this natural method of cooling yourself down might become inhibited or might become difficult or ineffective. And so we're going to look at different illnesses that can arise when that body's natural means of cooling itself down are no longer effective. So first we're going to look at heat rash. On the left side of the screen, it talks about the symptoms, and then on the right side of the screen, it gives information about what to do in an event. So on the left side, heat rash is characterized, or sometimes called prickly heat, is characterized by trapped sweat that occurs under the skin, and then when it tries to travel through the narrow ducts into the surface, it becomes clogged, thus creating these red clusters of small blisters that look like pimples on the skin. And they usually occur in the neck, chest, groin, or in elbow creases. And prickly heat or heat rash tends to be more common in warmer, more humid climates. So our Philadelphia summers, they tend to be extremely warm and very humid. And if you do experience heat rash, it's important to stay in a cool, dry place, keep the rash dry, and use powder like baby powder to soothe the rash. So sunburn, this is something that a lot of us have experienced at least once in our life, right? But sunburn can actually become a more serious problem for our bodies. So sunburn is typically characterized by painful red and warm skin. And if the sunburn is severe enough, blisters can actually form on the skin. And so the reason why sunburn can become more dangerous than just a benign red painful skin is because it can lead to dehydration or severe dehydration. Sunburn draws fluid to the surface of the skin and away from the body. And in those severe dehydration cases, someone can even go into shock. It might be characterized by fainting, low blood pressure, extreme weakness. And if any of those symptoms happen or occur, it's important for people to seek immediate medical attention. But otherwise, if you have sunburn, it's important to stay out of the sun until your sunburn heals. Put cool clothes on the sunburned areas or take a cold bath. Put moisturizing lotion on the sunburn areas. And it's really important to not break the blisters. A lot of the times we'll have little skin lesions and we want to pick at them, but it's essential that you don't break the blisters and to leave them alone, because by messing with the blisters, you can introduce infection to your body, and that could further complicate the situation. Oh, I'm sorry, can you go back to the last slide? Thank you. So in order to protect yourself or to prevent sunburn from happening, you can protect yourself from the sun by wearing a wide brim hat, sunglasses, and putting on sunscreen that's SPF 15 or higher 30 minutes before you go outside. And you should also continue to reapply the sunscreen according to the package directions. And there's much less ozone than there used to be, so the sun can be a lot more dangerous than it was years ago. So applying those methods should give yourself a bit more protection when being outside and in the sun. Now, heat cramps now we're kind of getting a little deeper into things that can be potentially serious heat-related illnesses. So heat cramps are heavy sweating, can occur after heavy sweating during intense exercise, and can feel like intense muscle pain or spasms. And so it's really important to understand that heat cramps can come if your body is depleted of electrolytes that we typically have in our drinks, or just by staying hydrated. So it's really important that if you do experience heat cramps, to stop the physical activity and move to a cool place. Drink water or a sports drink to replenish those electrolytes that you lost through the intense sweating, and then wait for the cramps to go away before you do any more physical activity. But the bottom portion here on this slide is extremely important. Someone should seek medical attention right away if the cramps last longer than an hour, if you're on a low sodium diet, or you have heart problems. Those heat cramps in those scenarios could be an indication that a more severe heat-related illness is occurring, or it's an early sign of a severe heat-related illness. So contact or seek medical attention right away if you do experience any of those. Heat exhaustion it happens when the body overheats and has a hard time cooling itself down through that sweating method that we talked about earlier. And so it's heat exhaustion. The signs and symptoms include heavy sweating, cold, pale, and clammy skin, fast, weak pulses, nausea or vomiting, those muscle cramps I just mentioned, tiredness or weakness, dizziness, headache, fainting, or passing out. And so if you or someone that you're with you might suspect that they are experiencing a heat exhaustion, move them to a cool place, or move yourself to a cool place, loosen your clothing, put cool, wet cloths on your body, or take a cool bath. And at this point, it's okay to sip water. But again, it's extremely important to seek medical attention right away. If you're throwing up, your symptoms get worse, or your symptoms last longer than an hour. In that scenario, again, it could be an indication that there's a more serious heat-related illness that's occurring, like heat stroke. So we can go to the next slide. And heat stroke is the most serious heat-related illness. It occurs when the body becomes unable to control its temperature. The body temperature rises rapidly, the sweating mechanism fails, and essentially the body is unable to cool itself down naturally. And so heat stroke is many of the signs and symptoms of heat stroke include high body temperature. So typically an internal body temperature of 103 degrees Fahrenheit, or higher, hot, red, dry, or damp skin, fast, strong pulses, headache, dizziness, nausea, confusion, losing consciousness, or passing out. And I would really like to reiterate here is that a heat stroke is the most serious heat-related illness. So it's essential that you call 911 right away, because I want to say one more time, heat stroke is a medical emergency. You want to move the person to a cooler place, help lower the person's body temperature with cool cloths or a cool bath. Essentially, you want to cool their body down in any way possible. So even if that includes if you're outside at a barbecue and you have a hose nearby, hosing them down with water, or anything that can cool them down with towels, it's essential that you cool the body down as fast as you can. And then lastly, don't give the person anything to drink. Usually we do think that if you notice that someone is hot or might be experiencing a heat stroke, that water can help their symptoms. But essentially, at this point, water can actually be more dangerous for them and can cause them to choke. And that can make the situation even more complicated, right? So remember, don't give the person anything to drink and call 911 so they can get the medical attention that they need. And so the key takeaway here, and on this slide, there is an image that's in a big square that says, in case of an emergency, call 911. So again, if you suspect that you or someone you're with are experiencing a heat-related illness, it's important to cool off, get help, and call 911 immediately if you think it's an emergency. There's no need to try and discern if the symptoms are a heat stroke or heat exhaustion. If you think that that person or yourself needs medical attention, do not hesitate to call 911. So on this slide, there's a column that's listed as risk factors, and then the other column is listed as for the groups. So the people who are at most risk are people who have prolonged exposure. And so that includes people who work outside, people experiencing homelessness, athletes, and people without air conditioning. And then there's social factors, so people who are living alone, or people that are homebound. And then biological factors include older adults, infants and young children, pregnant women, and people with chronic medical conditions. And so now we're actually going to look at the people that are at the highest risk or have the most risk for experiencing a heat-related illness. And so again, people without air conditioning, because they never get a break from the heat, people who live alone. So actually, in July of 1995, a Chicago heat wave occurred, and it lasted, I think, about 5 days. And in that extreme heat event, 739 people died due to heat-related illness. And they found that the people who are at highest risk for dying related to heat were people who lived alone. And that was because they didn't have anyone to check on them and make sure that they had enough water, to make sure their windows were open, or they had a method of cooling themselves down. And unfortunately, a lot of lives were lost. And then the last one that's listed under social factors are people who are homebound.
Là những cái người mà làm việc ở nhà, những cái người mà chỉ được ở nhà không thôi.
And then last but not least, there's the biological factors. And the biological factor would be older adults are at the highest risk for experiencing a heat-related illness. And this is mainly because older adults don't typically adjust as well as young people to sudden changes in temperature. They're more likely to have chronic medical conditions that changes the normal body response to heat. And they're more likely to take prescription medicines that affect the body's ability to control its temperature or sweat. And so we're going to talk a little bit more about that on the next slide. And so the heat and chronic health conditions that we're going to look at the relationship between those are the conditions of concern would be diabetes, heart disease, kidney disease, respiratory disease like asthma or COPD, mental health conditions, and for those who take some medications like beta blockers. And if this applies to you, and you might look at your medication or your pill bottle that says the medication with LOL at the end. So like labetalol is a pretty popular one. And diuretics or water pills. And that diuretic might look like hydrochlorothiazide, or might be abbreviated as HCTZ. And then, so if you are someone who does take medications like this, it can affect your body's response to heat. Another medication that is actually over the counter would be something like Benadryl, which is an antihistamine. A lot of us take them in spring and summer months because of allergies. But Benadryl specifically are one of those medications that can actually affect our body's ability to sweat. So it's really important that if any of these medications or conditions apply to you, I would encourage you to talk to your doctor and learn more about ways that you can reduce your risk of experiencing a heat-related illness.
Before moving on, I just wanted to check to see if there were any questions in the chat box.
Yes, there's one question. The question is, should we use ice on their body if we think they're having a heat stroke?
Yes, that's a great question. And so, yeah, ice can be used if you believe someone is experiencing a heat stroke. Again, it's really important that you cool their bodies down as much as you possibly can, because doing so will reduce the risk of prolonged injury or illness after they've recovered from heat stroke. So yes, ice is an appropriate method of cooling someone down.
Thank you. That's the only question for this section.
Great, thank you, Sydney and Becca. Now that you've learned about heat in the city and recognizing the signs of heat-related illness, you might be asking, what can you do next? So first, stay informed, pay attention to local weather conditions, and know when weather might be harmful to your health. Multiple days of high temperatures are most dangerous. And again, knowing those signs of heat-related illness that Sydney went over. Second, stay cool. If you can, avoid direct sunlight and limit your time outside. The third would be stay hydrated. Drink plenty of water or fruit juices throughout the day. And don't just drink when you're thirsty, so your body's temperature can stay regulated. And avoid drinking things like alcohol or caffeine and sugary drinks because they can cause dehydration. And one of the most important things to do during a heat event is make safe contact with those at-risk individuals in your neighborhood that Sydney mentioned. Check that your neighbor is using air conditioning if they have it. Invite them over to your place if they don't and you do have air conditioning. Make sure they're drinking plenty of water and fluids again throughout the day. Avoid physical activity. Wear light clothing. And know that, again, those signs of heat illness. And know when and how to get help. So what does the city do on hot days? The city does have a warning system to let people know when they should be concerned for their health, especially during extreme heat events. And this is called a heat health emergency. When a heat health emergency is declared, PECO will halt utility shutoffs. The Philadelphia Corporation of Aging Heat Line will activate, and that number is 215-765-8255. 9040, and we'll talk a little bit more about PCA. And then PDPH mobile teams will also be activated. So our teams will go to those vulnerable neighborhoods from the heat index to check on residents. And then lastly, our cooling centers will have extended hours so you can spend more time in the air conditioning. And to find a cooling center close to you, you can call 311.
So during a heat health emergency, the Philadelphia Corporation for Aging operates a call center for people to get heat safety tips. And one might even call in asking a medical related question. And so if someone does have a medical related question, they may be referred to a PDPH nurse or a Philadelphia Department of Public Health nurse who may recommend sending out a Philadelphia Department of Public Health mobile team, depending on the caller's medical concerns. These teams go to individual homes to conduct environmental assessments and discuss precautions for extreme heat events. And on the slide, so I deviated from the slide a little bit, but on the slide it reads, health department nurses can speak with you about medical problems related to the heat. But the heat line does not give out free air conditioners or fans. But Juliet will talk to you very shortly about what to do if you don't have air conditioner in your home, and when you should not use a fan.
Thanks, Sydney. If you do not have air conditioning in your home, we do recommend using a fan. And that's when outdoor temperatures are cooler than indoor temperatures. If you place a fan in an open window to move the cool air from outside throughout your space, it's really helpful. Also, during the day, to limit some of that sunlight, you can close your curtains. And times when we don't recommend to use a fan, it's when indoor temperatures are hotter than 95 degrees Fahrenheit. And we say this because fans don't really process cool air, but when it's hot inside of your home, it would just move around that hot air, and that can be harmful to your health. And so we recommend to seek air conditioning at someone's home if you can, or visit a cooling center if available. And so next we are going to talk about some city resources that are available to you this summer, and we hope that you will write down some of this information so you can make good use of it. And so we have been mentioning cooling centers, and cooling centers are air-conditioned spaces that stay open late during a heat health emergency. And this can be your local library or rec center, maybe a cooling center. And again, to find a cooling center close to you, call 311. If you can't get to a cooling center, visit your local senior center, a shopping mall, or a friend with air conditioning, because even a short time in air conditioning can be helpful to help your body recover. Public pools are also a great way to cool off with the family. The city has 50 pools that will be opening this summer. City pools also offer free swimming lessons. For more information about city pools and for the pool opening schedule, visit phila.gov/PPR. And then we also have spray grounds around the city, and you can see a picture of them on the kids playing in them on this slide of the fountains spraying the water out. And so to find a spray ground close to you, you can visit bit.ly/spraygroundfinder. We have mentioned the importance of using air conditioning, but we also realize that it can increase your bills. And so USAF has a utility assistance program where you can receive up to $1,500 to pay for your energy bill. You can contact USAF at 215-814-6837 for more information and to apply, or email them at utility@usfacts.org, utility@usfacts.org. And the next slide is just the flyer that they have available with more of the resources that they have. You can also scan the QR code to fill out their contact form, but they have a benefits access center, information on housing stabilization and veterans program. If you would like a copy of this flyer, we are able to mail you them, so you can let us know for your own distribution. And lastly, we have neighborhood energy centers, which are a great resource to help with utility assistance and providing information on conserving energy through the summer. On this slide is a list of the energy centers, and to find one in your neighborhood, you can scan the QR code below or visit bit.ly/neighborhood energy centers. And we will provide you all with this information after the session. And so if you'd like to more extreme heat resources, you can visit our website at phila.gov/heat, where you can find a number of different printables and more information on city resources and how to stay cool this summer. Also, if you would like to receive up-to-date alerts on public health emergencies and severe weather, you can text Ready Phila to 888-777 or visit phila.gov/ready. And lastly, we ask that you join the Preparedness Program Community Response Partner Network to receive critical information during public health emergencies. And if you would like to get in contact with us, you can email us at publichealthpreparedness@phila.gov or leave us a message at 215-429-3016. I will now turn over to Rebecca Pizer, the Outreach Manager, to answer any questions that we may have received in the chat.
Thanks so much, Juliet. Would somebody be able to go back to the slide before keeping Philadelphians in their homes when a participant requested that? The slide right before keeping Philadelphians in their homes. Linda, if that's, you can type to me if that's not the right one and we can get you the right slide to look at. There's another question asking about city program to help residents repaint their roof silver or white. And that would be a great question for the neighborhood energy centers. So when we send out this information later, you'll have information on each neighborhood energy center, and you can call the one that's in your neighborhood and they'll be able to connect you with resources for residents to help repaint your roof and do other energy saving methods. And another question came in asking about information for where seniors can have access for pools and exercise facilities. And we will send out all of this information, as Juliet mentioned, after the event is over. And we recommend that you call the PCA. If we could go to the slide with that phone number, please. This phone number is the best number to get information about resources and services and activities specifically for older adults in Philadelphia. So that's all the questions that we have at the moment. We can wait another minute or so. If anyone has any more questions, you're welcome to put them in the Q&A. Or if we could go to the last slide that has our contact information. You can email us or call and leave us a message if you think of any questions after this is over. And we will send you an email with a packet of information, lots of resources. And if you'd like us to do a presentation like this for your community, please reach out to us and we'd be happy to set it up and talk about it. We just got another question asking what languages information is available. So that's a great question. The packet that we'll send has materials in 12 languages and other materials in 5. So I will make sure that we get all of that information out to you and we can put the specific languages in this answer box as soon as I look them up to confirm that I have the right answer for you. Thanks so much for asking. All right. I think if there's no more questions, I just want to thank everyone so much for joining us for this presentation. And please let us know if you have any suggestions or feedback, or if you'd like to stay in contact in the future for future presentations. We'll be doing another one of these in the early fall on respiratory diseases like COVID and flu to help people prepare for respiratory illnesses that tend to come in the fall. Thanks so much, everybody. Stay safe, stay cool, and please reach out if we can do anything to help.